Let me just begin by saying that Jamaica has recorded its third COVID-19 patient death. The third patient is a 41-year-old male from Westmoreland who had a travel history from the UK. He tested positive on March 23rd. He had some underlying conditions, and experienced renal failure, and regrettably passed away earlier this afternoon. The second patient, who died yesterday, cause of death is still under investigation, and we did send out a statement with some particulars, but we are going to reserve final conclusion until those investigations are completed. Jamaica now has a total of 44 confirmed cases of COVID-19. Today we received information from the National Influenza Center, which advised us of 6 new confirmed cases. This represents the highest number of positives we've had in terms of a batch of tests, except though I'd like to just say that we did quite a number of tests. I think it was 53 tests. So of the 53, 6 are positive. All of the 6 positives are linked to the quarantine community in southeast Clarendon of Cornpeace. One of the 6, a 53-year-old male, had traveled with the index case, so has a travel history from New York. And you will recall that that index case was the first person, a 79-year-old male, to have passed based on the impact of the virus. So we quarantined the community. Our team has been on the ground. We have carried out tracing. We have identified persons, and we have done a number of tests. And in this instance, 6 of those tests have come back positive. The reality is the most effective way to control the virus's spread or to flatten the curve is for people-to-people contact to be kept at a minimum. And I think the Cornpeace experience is an indication, again, of why it is that we have to insist on compliance. And while I believe a number of Jamaicans are, I think it's fair to say, based on what we have seen and heard, a number of Jamaicans are not complying.
Of all the confirmed cases that we are seeing, it is the cases that have very severe symptoms that are likely to cause more infection in their contacts. So most of the cases that we have seen have had mild symptoms, and the pickup rate from their contacts are very, very low, almost none in some cases. The cases that have had severe symptoms, those are the cases where they're very close contacts, we're getting a high pickup rate. So I think based on what we're seeing, the network that we have spread across the country to detect, I think that we are able to detect what is happening in the country and therefore be able to respond to whatever happens. So of the 44 positive patients that we have, 2 were sent home, as you know. We announced the third patient that died, and we have 27 persons that are presently asymptomatic. Now, those persons that are asymptomatic, the number of days vary. So we are allowing 4 asymptomatic days before we do the first test for discharge. So we have some persons that are still within those 4 days, so they have not done their first test yet. And then we have some that have done a first test and some that are waiting on a second test. We have 8 persons that we would classify as having moderate symptoms. And by moderate symptoms, what I mean is that they are on oxygen therapy or they are wheezing. And we have 6 persons that have mild symptoms. And by mild symptoms, I mean that they have a sore throat or a dry cough.
So Clarendon, it's 10, Hanover, it's 0. Kingston and St. Andrew, 12. Manchester, 4. Portland, 1. St. Anne, 5. St. Catherine, 4. St. Elizabeth, 1. St. James, 4. St. Mary, 1. St. Thomas, 0. Trelawney, 0. Westmoreland, 2. There are 24 imported cases, 17 imported related cases, and 3 cases under investigation. In terms of the age, the average age of the confirmed patients is 51 years, ranging from a minimum of 12 years to a maximum of 87 years. And there are 21 females and 23 males who have been confirmed as having COVID-19 to date. In the meantime, we have 44 persons who are currently in isolation. 24 persons are under quarantine in a government facility. In addition, of course, to the 140 Cuban health professionals who are being quarantined, I think, until this weekend, when they will be allowed to engage the public health system to bolster our frontline defense to persons we have to treat with linked to the coronavirus. In terms of testing, we have done some 442 samples, including the samples that were tested for severe acute respiratory infections. 44 of that number would have tested positive, 394 negative, and we have 4 results that are pending. We hope to get the results of those later on today, if not tomorrow. What this shows, therefore, is that we have a positivity yield of 10%. So of all the tests that we have done to date, all 442, we have approximately a 10% yield, which by international standards is good. Having reviewed the protocol, we have had consultations with senior virologists and infection control specialists, of course, guided also by the WHO, PAHO. We are of the view that the testing has been sufficient to date in giving us an indication of the virus or the presence of the virus in the population. It has allowed us to monitor our healthcare frontline workers because they are also a part of that protocol of testing. And the more general testing that takes place for persons who have respiratory ailments and are in hospital but have no link to a positive case, we include them in that sampling. All combined, therefore, we think that we have a good sense of what is happening on the ground, and we are encouraged to date by the numbers. I'd like to announce that between now and the weekend, I think on Friday, we should be in a position to roll out the mobile testing mechanism. The ministry will be essentially engaging mobile units, which will be branded to indicate their purpose, and those units will be deployed in parishes across the country. We're going to begin in the Southeast Regional Health Authority, SERA, and Northeast Regional Health Authority region, and there will be a protocol assigned to the deployment of those mobile units where persons who have a desire to be tested would be subjected to that protocol in terms of an assessment done or triage, as would be done in an accident and emergency context. And if they meet the specific requirements or criteria, then the samples would be collected by those units and tests administered, and they'll be contacted and given appropriate counseling and guidance. This will increase tests across the country and will give an opportunity for persons to volunteer for testing. We have an app that is also going to be published that would allow persons to use a technology platform to also sign up if they think they want to be tested. Just to say, though, that The fact that you want to be tested doesn't mean that you will be tested. It's a function of the clinical assessment that would be done and the counseling that would be done. In terms of community quarantine, we continue to have the current peace settlement in Clarendon under quarantine. The residents have been supportive.
We really are monitoring 50 households in association with the first positive person from the Corn Peace settlement. The majority of those households are within the Corn Peace settlement, and then we have additional households that are in Portland Cottage, Longville community, and in Hayes. For those 50 households, we have interviewed over 250 persons, and there have been about 30 persons that we have identified as close contacts to the first person that was positive and then the second related contact that was positive.
In terms of home quarantine, the ministry would like again to remind travelers who have come into the island between March 18 and 23rd, 2020, from countries where there is local transmission, that they must self-quarantine for 14 days and, of course, report to the Ministry of Health and Wellness using the portal jamcovid19.moh.gov.jm. That's jam, COVID-19.moh.gov.jm. If you develop symptoms, of course, you can call the 8881-LOVE or 888-663-5683. I'm happy to announce that the Andrews Memorial Hospital will be used based on an agreement as an extension of the Kingston Public Hospital. So as needed, patients who are admitted at KPH would also, if necessary, and based on the appropriate arrangements, be housed at Andrews Hospital.
Each hospital was required to clear a ward to provide support for COVID. KPH is one of those hospitals that was identified and have responded by clearing at least 2 wards. This has reduced their capacity to treat with other patients who are probably medical patients or surgical patients. And so the plan that was agreed to with Andrews is that those medical and surgical patients who could be admitted to Andrews as an extension of their admission to KPH would be housed or would be accommodated in their facility.
In public health, we continue to provide updates between those 2 briefs to ensure that the public gets as much information as possible, to be extremely transparent around this process, and hopefully in so doing to give the country an opportunity to feel a part of the process, because we truly believe that the solution lies with all of us. The personal responsibility, the observing of the respective restrictions, the calling and providing information, the home quarantining, and of course the cooperation with the public health personnel on the ground in communities or in the respective institutions.